So the topic of today's lecture is antiplatelet and anticoagulant drugs, and we are talking about blood clotting today, and it's very comprehensive um, topic, and also there are so many causes of the drugs that influence the blood clotting and thrombocyte aggregation. So the uh, classification of the drugs includes uh, the so the first there are two groups of the drugs, and first group is antiplatelets that inhibit aggregation of the thrombocytes, and the second group of the drug is uh, anticoagulant drugs, and these drugs prevent the coagulation of the blood. And the platelet inhibitors include the oral agents like the aspirin, and aspirin is most commonly antiplatelet drug used at the moment, and the mechanism of action of the aspirin is inhibition of the cyclooxygenase, uh, and uh, aspirin is used in lower doses than the antipyretic and anti-analgesic drug. So the uh, also the phosphodiesterase inhibitor dipyridamole is used as a oral medication, and so the and then the ADP receptor antagonist clopidogrel, ticlopidine, and others are used for the uh, treatment of the uh, uh, platelet aggregation. So injectable agents include the uh, antibodies, abciximab and eptifibatide, as well as tirofiban, and these are new drugs that act on the GP receptors. So all these agents influence the thrombocytes, and they prevent activation of thrombocytes, and activation of thrombocytes prevents the aggregation of thrombocytes, and that prevents the development of the platelet. And platelets are very dangerous because the normal role of the platelet is stopping the to repair the damage of the vessel, but sometimes platelets are activated without damage of the vessel, and then they will produce thrombus, uh, and these thrombus can uh, can become a embolus uh, when it uh, it if it starts to if it disassembles from the vascular ball and then starts to float in the blood. So the detached thrombus becomes an embolus, and it is very embolus are very dangerous because uh, uh, they can stuck in the small vessels like for example coronary artery and lead to the ischemia and then to the myocardial infarction and for example angina pectoris and other diseases and uh, also uh, the venous thrombus are usually occur in the extremities and then lead to the vascular diseases. The Any physical trauma to the vascular system leads to the series of the interactions between the platelets and the saline cells and the coagulation cascade. So these interactions lead to the formation of the clot that prevents the blood loss and that repairs the damaged blood vessel. And the platelets are participating much in this process, and then the actually the platelets most of the drugs will influence the platelets. So the first drug is aspirin, and aspirin is inhibiting the cyclooxygenase, and so cyclooxygenase is located in the platelet and is producing a thromboxane A2 from the arachidonic acid, and this is an aspirin molecule, and aspirin will acetylate the cyclooxygenase, so this acetyl group will move to the enzyme and will acetylate the serine side chain in the peptide. So and then the aspirin will convert to the salicylic acid that is actually also have some antipyretic properties and energetic properties. So and this is a irreversible process, so aspirin is irreversible. It irreversibly acidylates the cyclooxygenase. So platelets, because platelets don't have a nucleus, they eventually, so they will not synthesize thromboxane A2 anymore. So that is why to synthesize a new thromboxane A2, the body have to synthesize new platelets. So the half-life of the platelets is about 2 weeks. So that is why the action of the aspirin will last for about 2 weeks. The aspirin is used as a prophylactic treatment, and it decreases mortality after the myocardial infarction, and The dose of aspirin is used usually 75 milligram. That it and can vary. The dose can vary from 50 to 300 milligram per day. So I think you know how aspirin is taken. So because it's very common drug, so aspirin is taken orally, and it's actually metabolized to the salicylic acid in the liver, and uh, and salicylic acid is actually uh, is excreted by the kidneys. The half-life is about 20 minutes, so this actually drug is rapidly metabolized. Um, the adverse effects include increased bleeding time, and that can increase a chance of hemorrhagic stroke and GI bleeding, especially if used in higher doses like 300 milligram. And also aspirin has the same mechanism of action as other non-steroidal anti-inflammatory drugs. So the if the patient takes other NSAIDs, then aspirin should be taken 1 hour after NSAIDs because that prevents the action of the aspirin. So the next group is the ADP inhibitors, and these are ticlopidine, clopidogrel, prasugrel, and ticagrelor. And these are newer group of the drugs that inhibit the action of the ADP, and these are acting on P2Y12 receptor, and they block the platelet aggregation by blocking this receptor. So that prevents the activation of the GP2B3A. So uh, and these drugs have the same indications as an aspirin, but the mechanism of action is different. Uh, the adverse effects include also prolonged bleeding, uh, and also the aplastic anemia. So the third group of the drug is the antibodies. So and all these are chimeric monoclonal antibodies: abciximab, eftifibatide, and tirofiban. So these antibodies bind to the GP2B3A receptors, and they prevent platelet aggregation, uh, and that prevents the formation of the complex with these receptors. So this aggregation is inhibited. So they are given, all agents are given intravenously. So usually with the heparin and aspirin. Uh, and Adverse effects include the also bleeding and especially when they are combined with a heparin. So the next group of drugs is anticoagulants. So coagulation uh, is a uh, is a formation of the clotting of the blood, and there are two ways: intrinsic pathway and extrinsic pathway, both of which will lead to activation of the clotting factors, and eventually they activate the thrombin. Thrombin is the most important clotting factor, and after the activation of thrombin, the clotting is irreversible. Uh, so there are uh, two drugs, two types of the drugs, direct and indirect. So direct are heparin and low molecular heparins will activate the antithrombin T3 uh, to uh, uh, so uh, the mechanism of action is of the heparin is based on the binding to antithrombin 3 and that leads to the inactivation of the coagulation factors. Antithrombin 3 is also active in activating the factors without heparin, but with heparin it's more active. So the heparin is administered subcutaneously or intravenously, and the low molecular weight heparins are administered subcutaneously only. And the heparin is acting very fast, so it usually in several minutes after intravenous administration. So, and the primary adverse effect of the heparin is bleeding, and that is why the bleeding monitoring is very important. And the antidote is protamine sulfate, can be infused slowly, also intravenously, and it makes a complex with a heparin that prevents the action of the heparin. The next group is the indirect uh, in, uh, in indirect anticoagulants, and these are taken orally. The primary drug is warfarin, and other coumarin anticoagulants are acting by the antagonizing the functions of vitamin K and the uh, so the mechanism of action of warfarin is based on the inhibiting the reduction of the vitamin K that is used in the activating clotting factor. So this is a clotting factor, and It is activated by gamma carboxylation. So this is alpha, beta, gamma, and this is a glutaryl residue of amino acid, and it is carboxylated at the third uh, carbon, that is gamma carboxylation. Uh, so, and this process is facilitated by the vitamin K, that is an coenzyme. After that, the vitamin K is oxidized, and then it is reduced by NADPH, but this reduction is inhibited by the warfarin, and that leads to the uh, depletion of the activated clotting factors. So because of this mechanism, the action of the warfarin starts off in several weeks. So that is why uh, its onset of action is very long, and not useful in emergency, but is useful for the chronic treatment. So that is why warfarin is used for prevention and treatment of the stroke, and warfarin is rapidly absorbed after oral administration, and it's bound to the plasma albumin, and that is why it's long acting. And because of the crossing the blood-brain barrier, sorry, the placenta, the warfarin is contraindicated during the pregnancy, and adverse effects include the hemorrhage, and that is why the bleeding should be monitored during the administration of the warfarin, and the antidote is vitamin K that can be administered intravenously or orally. And sometimes, in case of the emergency, the plasma transfusion is indicated. So warfarin is teratogenic and should not be used during the pregnancy. And during the pregnancy, the heparin is indicated as an anticoagulant. So I think that is all for today. So thank you for your attention, and see you next week.